Hey everybody, this is Jim Prusak, physical therapist with the Pain PT, and today we want to talk about the top 5 things that will keep you stuck in the chronic pain cycle. And there may be more than five, but I'm just going to break them down to what I think are the most important five that keep people stuck. Now, I've worked with thousands of patients over the years as a physical therapist in my 20-year career, and I've worked a lot with acute pain, subacute pain, and also chronic pain. And I can tell you that subacute and acute pain is way different from chronic pain. You may have learned some of that here by watching some of the videos about the difference between the two. But the body heals. In acute and subacute pain, the body heals itself, whether we have physical therapy, whether we go through chiropractic care, whether we get massage, whether we go to acupuncture or just visiting a doctor. The body heals itself. But with chronic pain, it's a whole different beast. We need to move beyond the body and look more at the brain and nervous system. So let's show you the top 5 things that'll keep you stuck in the chronic pain cycle. Number one is thinking you are physically damaged and this is the cause of your pain. This is probably the biggest impediment to people having a quick recovery from chronic pain. And Dr. Sarno, who was one of the first people to link up the psychological aspect of pain and other physical problems in the body, he talks a lot about we have to stop thinking we're physically damaged. And this is so true because with chronic pain, it's not physical damage. We know the majority of chronic pain is due to alterations in the brain and nervous system. And so once we've ruled out the physical damage, a lot of times we need to look at the whole picture. So plenty of people have changes on their x-rays, changes on their MRIs or other imaging reports. But as you may have seen in some of my other videos, a lot of times it doesn't correlate very well with pain levels. The messages we get from physicians and doctors and other healthcare providers that say, this is the cause of your pain, this ligament, this joint, this disc, this strain, this muscle, this nerve. We need to drop these things. When we're thinking that there's a physical cause to our pain and we're believing that, we're stuck. We cannot get out of chronic pain using this brain and nervous system approach if we believe we're physically damaged. So this is the number one thing we don't want to do with chronic pain. The second thing we absolutely do not want to do with chronic pain is to give up our physical activities or hobbies and exercises. We actually need to go back to doing all the things we've stopped doing, every single one of them, because we know with chronic pain, again, that it's not a physical injury. When I work with somebody with acute strain or coming off a surgery and they're an athlete or they're just wanting to get back to certain activities, we need to pace them along. We need to take them slowly while we let the tissues of the body heal. Otherwise, we run the risk of re-injuring that part of the body. But with chronic pain, enough time has passed in the body that the tissues are actually healed. So this is the thing, the tissues of the body have actually healed. And what we're dealing with here is, again, that altered nervous system and brain. So we need to go back to all these activities and hobbies. We need to know that when we're stopping these things and continuing to be afraid of them, we're actually reinforcing the very pain cycle that we're trying to get out of. Number three, thing you don't want to do with chronic pain, and I see this all the time in people, is continuing to obsess and worry about the pain and physical symptoms. Now, these are thoughts and beliefs, right? When we are worrying or concerned, when we do this, this creates and sets up the inflammatory fight or flight cycle through the autonomic nervous system in our bodies. These messages and electrical signals from the brain go into our body, and what it does is it causes us to still overprotect and guard via the muscles. This creates tension in the body, which then continues to create pain. So we need to drop this obsession and need to drop the worry, the concern, the fears. We need to let these things go around pain and physical symptoms. Once we understand that this is not a physical problem, that we're actually okay, that we're not damaged, we can start to let go of some of these thoughts and these beliefs that don't serve us well, and in fact actually contribute to the pain itself. Okay, number four thing you don't want to do with chronic pain, and we talk a lot about this here at the Pain PT, is to stuff your feelings, emotions, and stresses. If you haven't seen my other video about some of the research into emotion regulation, please have a look at it because we know from the science if you are repressing or suppressing your feelings and your emotions and your stresses, you're actually more likely to have pain and other health issues as well. So it's really important that you get in touch with your feelings and emotions around the pain, around the stresses in your life, and really acknowledge these things and be open to experiencing these things. This is really important. Otherwise, you're going to keep putting pressure on yourself and recreating that pain cycle through the nervous system. And last but not least, number 5 here, this is important, is that we need to stop looking for physical treatments to heal. This is something we do not want to do. Okay, we don't want to continue to pursue physical treatments for healing because we're not dealing with a physical problem anymore. This is not an acute pain problem. It's not a subacute pain problem where physical therapy may be appropriate, where acupuncture, massage, chiropractic care, and other things may be appropriate. And I can tell you again, as a physical therapist, working with a ton of people over the years, over 20 years, that I treat chronic pain completely different from acute pain. With chronic pain, I don't provide any physical treatment other than giving people advice to return to normal activities, hobbies, and exercises because we're not dealing with a physical problem. We're dealing with the brain and the nervous system. And when people continue to pursue physical treatments, what happens is that message is again being reinforced that there's a physical problem, that I'm physically damaged. And every time we work with somebody who gives us that message that there's something wrong in our bodies, that just reinforces this pain cycle. This reinforces the belief and the thought that there's something physically wrong. So this is why it's really important, and Dr. Sarno mentions in his books, to stop all physical treatments for healing. And I can tell you that as a physical therapist, so that's a pretty strong message. You need to stop these things. So these are the top 5 don't do's for chronic pain. I hope you uh, learned a little bit today about these things and can put these things into action. I'm also going to talk a bit more about the top 5 things we need to do to heal from chronic pain. You can see that in one of my other videos here. Take care, everybody.